Your skin isn't just the surface that keeps your insides, and it's your largest organ, your first line of defense, and one of the most powerful indicators of what's happening inside your body. While it might be easy to overlook small changes in your skin, these subtle shifts often hold deep insight into your overall health and well-being. In fact, because your skin regenerates roughly every 28 to 30 days and reacts quickly to imbalances or stress, it's often the first place where warning signs appear. Whether it's dryness, discoloration, inflammation, or unexplained irritation, your skin is constantly sending you messages about how your internal systems are functioning. Some signs are obvious, like bruising or hives, but others can be easily dismissed unless you know what to look for. That's what makes skin such a powerful diagnostic tool. In this video, we're going to take a deep dive into 9 important things your skin may be trying to tell you about your internal health. And before we begin, it is important to note that everything presented in this video has been fact-checked and reviewed by medical professionals. While this information is educational, it's not a substitute for medical advice, so if you notice something concerning, don't hesitate to reach out to a qualified healthcare provider. With that said, let's get started. The first sign to pay attention to is dry, flaky, or peeling skin. While it might seem harmless, consistently dry or peeling skin can point to several internal imbalances. Dehydration is one of the most common causes. When your body isn't getting enough water, your skin is among the first systems to be affected. But beyond water intake, dry skin can also be linked to a deficiency in essential fatty acids, like omega-3 South, which help maintain your skin's natural moisture barrier. Low vitamin A or E levels can cause similar issues, particularly if your skin feels rough or scaly. In more serious cases, dry skin might be a symptom of hypothyroidism, a condition in which your thyroid gland doesn't produce enough hormones to support proper metabolism. This slows down cellular turnover, leading to drier skin, hair thinning, and fatigue. Chronic dryness may also indicate diabetes, especially if it's accompanied by itching or delayed healing of small cuts. Environmental factors like harsh soaps, cold weather, or long hot showers can make things worse. But if your dryness doesn't improve with moisturizing, it might be time to look deeper. Next, let's talk about yellowing of the skin, also known as jaundice. Jaundice occurs when there's too much bilirubin in the bloodstream, a yellow pigment that's produced during the normal breakdown of red blood cells. Normally, the liver processes and eliminates bilirubin. But when the liver is overwhelmed or damaged, this pigment can accumulate and tint your skin and the whites of your eyes a yellowish hue. This is commonly seen in liver conditions such as hepatitis, liver cirrhosis, or bile duct obstruction. Newborns often experience temporary jaundice, but in adults, it is almost always a red flag for underlying liver dysfunction. Other symptoms that may accompany yellowing of the skin include fatigue, dark urine, and pale-colored stools. If your skin starts to yellow, don't delay. This is one sign that warrants immediate medical evaluation. Moving on to hyperpigmentation, or dark patches of skin. This type of discoloration can have many causes, but one of the most concerning is its link to insulin resistance or type 2 diabetes. A condition called acanthosis nigricans often presents as thick, dark, velvety patches of skin, especially around the neck, armpits, elbows, or groin. These patches may look dirty or feel rough, but they're actually a sign that your body is struggling to process insulin effectively. It can also be seen in people with obesity or polycystic ovary syndrome. Hyperpigmentation might also occur after inflammation, injury, or acne, or it could be due to hormonal changes such as those that happen during pregnancy or while using birth control, leading to a condition called In rare cases, darkening of the skin could be associated with Addison's disease, a condition in which your adrenal glands don't produce enough hormones. If you notice new or unusual dark patches of skin, particularly if they're spreading or changing in texture, it's a good idea to get checked by a healthcare provider. Let's now focus on pale or washed out skin, a common but often overlooked symptom of anemia. Anemia is typically caused by a deficiency of iron, vitamin B12, or folate, which affects your red blood cell count and therefore reduces the oxygen carrying capacity of your blood. When your skin looks paler than usual, especially your lips, gums, inner eyelids, or nail beds, it may be a sign that your blood isn't delivering enough oxygen to the teeth. People with anemia may also experience fatigue, shortness of breath, headaches, and dizziness. While mild anemia is common, particularly in menstruating women or those with poor diets, severe anemia can have significant health implications if left untreated. Other possible causes of pallor include blood loss, internal bleeding, chronic kidney disease, or certain bone marrow disorders. If your skin looks paler than usual and you also feel weak or short of breath, it's time for a blood test. Another change to watch for is red or flushed skin, which may be caused by various internal and external triggers. A flushed face might simply mean you're hot, embarrassed, Or exercising but persistent redness could indicate rosacea, a chronic inflammatory skin condition that affects the central face. Rosacea can flare up due to alcohol, spicy foods, stress, or heat, and it may include visible blood vessels or bumps that resemble acne. Another potential cause is lupus, an autoimmune disease that often causes a butterfly-shaped rash across the cheeks and nose. If you experience this pattern of redness, especially with joint pain or fatigue, it's worth investigating further. Flushed skin may also point to hormonal changes, such as those that happen during menopause, or it could be linked to high blood pressure or allergic reactions. Sometimes, even niacin supplements or medications can trigger flushing. It is important to consider the context and whether the redness is persistent or accompanied by other symptoms. One particularly uncomfortable sign your skin can give is itchiness without a visible rash. While it could be something as simple as dry skin, persistent unexplained itching may be a sign of systemic disease. Chronic kidney disease is one of the main culprits when your kidneys don't function properly. Waste products can build up in your blood, leading to widespread itching. Liver problems like cholestasis can also cause itchiness, especially on the palms and salts. Additionally, thyroid disorders, certain cancers like lymphoma, or even iron deficiency can all trigger itchiness. If your skin is constantly itchy and doesn't respond to moisturizing or especially if there's no rash, it's time to dig deeper. Let's talk now about bruising isole, which may not seem like a skin condition at first glance, but your skin's reaction to trauma can say a lot about your internal state. If you find yourself bruising from minor bumps or without any obvious cause, it could indicate a clotting problem. Blood clotting depends on platelets and clotting factors, and deficiencies in these can be due to vitamin C or K deficiencies. Certain medications like blood thinners or conditions like thrombocytopenia, in rare cases, easy bruising can signal more serious issues like leukemia, hemophilia, or liver disease. The liver produces many of the body's clotting proteins, so if it's not functioning properly, bruises may appear more frequently and take longer to heal. It is also worth noting that aging skin tends to bruise more isole, because it becomes thinner and loses protective fat. However, if you notice large, frequent bruises without any clear cause, it's a good reason to get checked out. Now let us explore a skin issue that many people experience but don't always connect to internal health: adult acne. While acne is typically associated with adolescence, persistent or sudden breakouts in adulthood may signal an underlying hormonal imbalance. For women, this is often linked to polycystic ovary syndrome, which causes irregular periods, excess androgens, and ovarian hormonal acne usually appears on the lower face, jawline, or chin and may worsen around menstruation. Stress can also contribute to acne by increasing cortisol levels, which in turn stimulate oil production. Certain medications, high glycemic diets, and even undiagnosed food sensitivities can also play a role. In some cases, adult acne is the result of poor skin hygiene or product buildup. But when acne persists, despite proper care, it's worth considering blood tests to assess your hormone levels, insulin sensitivity, and overall inflammation. Another important condition to watch for is rashes or hives, particularly if they appear suddenly or recur frequently. Rashes can be caused by everything from contact dermatitis and allergies to autoimmune diseases and viral infections. Hives raise, itchy welts on the skin are typically linked to allergic reactions, but they can also result from chronic stress, medications, or even exercise. Autoimmune conditions like lupus, dermatomyositis, or celiac disease may also cause specific types of skin rashes, often with other symptoms like fatigue, joint pain, or digestive issues. Psoriasis, another autoimmune disease, causes red, scaly plaques that often appear on the elbows, knees, or scalp. Eczema, while not autoimmune, is an inflammatory skin condition that can also be triggered by allergens or stress. If your rash is persistent, painful, spreading, or accompanied by fever or swelling, it's important to seek medical attention. Finally, your skin might reflect internal imbalance through more subtle signs, such as changes in texture, elasticity, or wound healing. Skin that suddenly becomes thin or tears isole may be a sign of aging, but it can also point to prolonged steroid use or Cushing's syndrome, a hormonal disorder. Slow wound healing is often linked to diabetes, especially if wounds become infected or take weeks to close. Collagen loss, which affects skin firmness, can also result from poor nutrition, chronic stress, or smoking. If you notice that your skin looks dull, sags more than usual, or bruises from minimal contact, it might be worth looking into your nutrition, hormone levels, or underlying medical conditions. In conclusion, your skin is not just a cosmetic feature, it's a living, breathing reflection of your internal health. It responds to hormonal fluctuations, nutrient levels, immune responses, and organ function. While occasional dryness or blemishes may be normal, persistent or unusual changes in your skin's color, texture, or appearance can provide crucial clues about underlying medical issues. Learning how to recognize these signs empowers you to take better care of your body and potentially catch serious conditions early. If you notice any of the symptoms we discussed, such as chronic dryness, unexplained rashes, discoloration, itching, or bruising, it's worth consulting a doctor or dermatologist. Your skin is speaking. The question is, are you listening?